you and we'll see if it works. Yay! Hi, Kallie. How are
Good. How are you?
you? Good. Well, everyone, this is Kallie. I'm not going to do too much of an introduction because I really want her to speak for herself. However, she's amazing. She's gone through a lot in her lifetime that most people don't go through in their whole lifetime. So I'm really excited for her to share her story with you. But the first thing that I'd like to know, Kallie, is, and I don't think I even know the answer to this, how did you first hear about natural family planning?
Yeah. I've heard of natural family planning like my whole life, growing up Catholic, but I never heard of it in terms of like a positive way. It was more like, my mom's mom had 7 kids and my dad's mom had 9 kids, and so it was like just always a joke in our family, like, oh, natural family planning, like it doesn't work, like you end
Right.
up with 10 kids. And so it wasn't until I was engaged and I was 26 years old that I learned like what natural family planning truly is
Mhm.
and the awesome benefits. So yeah, I was like about 2 years ago, I think 2, 3 years ago is when I actually like learned, what natural family planning is. So
And what made you guys decide to pick the Creighton model over the other awesome methods that are out there?
um we when we got engaged, we started talking about what we were going to do for family planning. And we honestly just started like Googling, and the Creighton model was the first thing that we found. And we just like, we didn't look into anything else because we were like sold after we had learned about it. My mom had kind of talked to us about like the method they used to use with like temperature checks, and
Mhm.
she didn't feel like as strongly about that, but that wasn't like a make or break for, I don't know, that was like the only research we did, I guess, so it wasn't like a ton. But we we were sold after we learned about it and started getting into it, and so we didn't really seek out other methods.
Gotcha. Well, I want to give you some time to tell your story, and I don't really want to ask any leading questions because I want you to start wherever you want to start with what kind of what you went through with learning natural family planning and where you guys are at today.
Yeah. I guess that's kind of a long story.
I'm going to let you answer that however you would like.
Yeah, it's like loaded. Um, when I was 9 years old, I was diagnosed with leukemia, AML, and I went through several rounds of chemotherapy, and then a bone marrow transplant. Everything like turned out well, recovered. Um, I live in Iowa, so all of my treatment was at the University of Iowa. And so I'd go back for appointments there every few months, and then it turned into every year. And when I was 14, I didn't like have a period yet, and so the doctors were like, we're going to start you on birth control because we think that you have premature ovarian failure from the chemotherapy. It's like a common side effect. So we're going to start you on the pill, so you can start getting a period and getting a period.
Yeah, right.
and and the pill is going to provide your body with the hormones that it needs that it's not making on its own. So we listened, and like we, as like me and my mom, my parents, and I started on birth control when I was 14, and the first few months of it were like horrible. I had horrible cramps, super heavy bleeding. I was playing sports. I was in high school, and I was like leaving basketball games in the middle of the game to like go to the locker room and like change my tampon. Like it was horrible. And we put up with that for like 4 months. And then my mom took me back, and she was just like, this isn't working for her. And so they put me on a different birth control pill. And then that I was getting my period monthly, and I wasn't having the cramps that I was having. And it was like more regular. And I stayed on that for like 13 years. Every year we went back to the doctor, and they just said, are you happy with the pill? Like, are you having cramps? No. Great. Like, okay, just keep on it. And that's like that was the basis of the diagnosis of ovarian failure, was that I didn't have a period. And but we like trusted the doctors, and that's why I just like continued to take it. When I got into my 20s, then every year I went to the doctor to get my birth control pill, a new prescription, or get it refilled. They started talking to me about, well, whenever like you're ready to like start family planning or start having children, you're probably going to have to do IVF because you don't have any eggs. And, you know, you might want to start now, like reaching out to like your sisters and talking about like them donating their eggs. And I like left every appointment, like just kind of like, oh, this is like a whole new world to me. Like and I was in college, and so it wasn't anything like I thought too more about. And then when I met my husband, at the time in college, we like briefly talked about, you know, I potentially can't have kids of my own someday. Like, what does that look like for you? And he was just like, well, we'll figure it out together. But then like, that was it. We got engaged in 2017. And then we started actually talking about like, we want children. How are we going to acquire children? Are we going to adopt? Are we going to do IVF? What are our options? And IVF was something like we weren't comfortable with just like jumping in and doing right away without like more research and like more figuring out. Like, it's like, I've been on a pill for 13 years. Like, I need to get off a pill, and like maybe like a miracle can happen. I'll just like get pregnant. And so we decided to stop going to the university for treatment. And that's when I started researching different options for women's healthcare. And I came across the Pope Paul VI Institute in Omaha. I think they're renamed now. Are they?
Just what's Saint, I think.
Yeah.
That's terrible. I don't even know.
St. Pope Paul, I think, is, yeah, the clinic in Omaha.
Yeah.
And that's when I learned about the Creighton Model, because that was on the website. And yeah, I reached out to Kristen, and we started charting. So we were engaged in December 2017, and I came off the pill, and it took several months for me to get my own period. And a NAPRO doctor did see me because of my past history, my diagnosis of ovarian failure. They saw me sooner than they would probably see most clients. And when I went to see the NAPRO doctor, she wanted like a full history. She looked up all of my charting from the University of Iowa, and she never found blood work that diagnosed ovarian failure. And she never found like the appropriate testing that diagnoses ovarian failure. And so she pretty much came to the conclusion, like the doctor said, you have ovarian failure just because you didn't get a period when you were 14. And so for the last 13 years, you've been taking artificial hormones for possibly no reason, or for no reason, because the hormones, we don't know. Like, my body was still coming off the pill after 13 years. So we were like unsure what my cycles were going to look like. And we continued charting. I did blood work, hormone panels, and my LH and my FSH levels like looked good. And the NAPRO doctor was like, I don't believe you have ovarian failure. And so it was like wonderful news. They did like an ultrasound of my ovaries, and the NAPRO doctor was pretty convinced that we could, once we got married, we could just start trying and see what happened. And we were married for 2 months, and we got pregnant naturally. So it was like shocking at first. We like didn't believe it. Because when you're told for 13, 14 years, you'll never have kids of your own, you'll need to use your sister as an egg donor, or you'll have to go through IVF to get pregnant. It was very shocking. We like didn't believe the test results for a while. We didn't tell anyone for a while, besides our doctor. And what was great about having a NAPRO doctor monitor our pregnancy is we did a lot of blood work throughout my pregnancy to measure my progesterone levels. And I was prescribed progesterone injections during the pregnancy to reduce my risk of miscarriage and preterm labor because my progesterone was low during pregnancy. And had we not been followed by a NAPRO doctor, we likely wouldn't have known I had low progesterone during pregnancy. So that's our story. We didn't find out what we were having. We ended up, I delivered a little girl. She's now a year old.
And the cutest little girl you'll ever see. That's for sure. She smiles all the time.
Yeah, she is. Yeah, she's great. She was born on July 2nd, and I carried her to 41 weeks. Healthy. She's been like sick one time.
And I think your story is also so important because a lot of cancer survivors are told this. They're told that they're not going to be able to conceive on their own. They're told you need to be on the pill because we need to give you these hormones that we know are synthetic and they really are not helping women at all. So your story is just, it's such a good story of hope too for all those women who are told that. And of course you would believe it. You're told by the doctors that you trust.
Yeah.
Incredible. So I said before you got on here, I was like, I'm going to cry. And I am because, well, I'm pregnant, so I cry all the time. But I just said that your story and just everything you've gone through just always makes me very emotional because I'm so happy for you guys. And for those that you don't know, Kallie's married to my cousin. So she's in the family. So it makes it even more exciting. Her husband's dad and my dad are twins. So it's just, I'm happy for all my clients, but for someone that joined our family, I'm just over the moon excited. So really thank you for sharing your story. It can be an intimate topic for sure. So the fact that you're willing to share and to help other women who might not know about these options is incredible. I want to kind of turn it back to the Creighton Model just because it's NFP week. And I'm curious, and I don't know this, what did you find was the hardest part about learning the Creighton Model?
Right away, it was just like remembering to chart and remembering to pay attention to your body. But that was really it, because after you got used to that and like it became a habit, it was super easy. Yeah, I would say that was the hardest part right away, was just remembering to chart every night and record what you saw for the day.
Yeah, it's hard to get into the new habit.
Yeah, and right away, just like determining, classifying what your mucus looks like for the day, deciphering, was it, all the different levels. So.
And if you could go back, what do you wish, or if you could tell people, what do you wish you would have known before you started the Creighton Model?
I wish I knew about it sooner.
Yeah.
I wish I didn't take artificial birth control for 13 years for no reason. Yeah, I wish I knew about it sooner. That's really all I can. I don't think there's anything about the model that I wish I would have known before other than just knowing about it.
So those that are hearing your story and are thinking about maybe looking into it, what would be your advice to them?
Definitely, it's very worthwhile to try. It becomes super easy to learn it once you do, and it is such a great predictor of your overall health. I'm like so in tune with my body now because I chart. Like I know exactly, when my period should come, or if I'm late, or when I am ovulating. So my husband and I can decide, like, do we want to try and achieve a pregnancy this month, or do we want to wait till next month? And whereas like if you take a birth control pill, sometimes you have to be off of that pill for a while in order to get pregnant. And with the Creighton Model, you can decide every single month depending on what happens in your life for that month or that time or that week. So yeah, that I think that's like the greatest part about it. And then there's so many great things about it. Like if there is something wrong, you get such individualized care, and you have doctors who look at the root of the problem, if there is a problem, and instead of just like treating you with a Band-Aid with different pills or with IVF, or if you're not ready for if that's not something you want to do, and you just have a lot of options because you're being treated like such an individual. And the doctors know a ton about you just by looking at your chart.
Yeah, it's amazing how much data we collect just by charting, how much we can know what's going on just from the charting. Well, Kallie, thank you very much for joining today. I'm going to let you get back to your little one. But if anyone has any questions, message me too, and I'm sure we can get those answered for you. Anything else you want to add, Kallie, before we end our Instagram Live here?
I don't think so. Yeah, just feel free to ask any questions.
All right. Well, thank you. Have a good rest of your day.
Yeah, you too. Thanks, Kristen.
Yep. Bye. Bye.